Hello, my name is Amy Sturkey. I am a pediatric physical therapist. I'm here with Jack, and Jack is 13 years old, and he has spastic quadriplegic cerebral palsy. And what we found is that Jack has a 65-degree scoliosis, which means he's scheduled for surgery in a couple of weeks. One of the things I think about right before surgery is he's about to have a 60 to 70% improvement in the curve of his scoliosis right after surgery. And so muscles that are really cranked down tight are suddenly going to be really very stretched. So right now, Jack prefers to have his hip higher on this side and lower on that side. This is like his resting position. So these muscles are short. These muscles are really long over here. So I want to do something that's going to really stretch nicely the muscles on this side in preparation for surgery. So a classic move that a physical therapist would do would be to stretch these muscles. So I'm going to take these hips and see how far I can take them off to the side and try to get as much length on his left side compared to his right side. Now, a lot of times what I find when I do this is kids just kind of spin in a circle. So you want to try to keep the shoulders square and really press over so that you get his hips over and you get lengthening on this side, shortening on that side. Now, the other way to look at this is from a TMR perspective. That's total motion release. And this movement they call lower trunk side bend. So I'm going to, they would go, if you had a difference between the sides, which we clearly do, you'd go to the easy side and hold it and hang out for a while. And their thought is that these muscles are tight on his left side. And if you go over and you shorten those muscles even more than they already want to be, that it helps them relax and chill. Jack, does it feel relaxed and chill? And after you hold this position in the shortened position, that afterwards, it's easier then to take them to the opposite side. Now, if it were not for the purposes of this camera, I would hold this longer. But because of this, we're just going to go ahead and try the other side and see how it compares. So you can see how high this pelvis is compared to that one. Let's see what happens. We try to go the opposite side. Now, often what I end up getting is just simply going toward neutral. But it looks like now I'm actually got this side higher than that side. And I feel like I'm probably getting a similar stretch as what I got before. It's so funny. What is so funny? I love that Jack is tolerating this well. And I really want to do everything I can do to help prevent him from having spasms post-op. It's just an easy way to work on these stretches pre-op. I hope it's helpful for you, and we'll look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.